it's Dr. Connie with Forum Health Greenville, and I'm here today to talk about some dietary changes that you can make today that can help your heart health. A lot of this is within your control. So number one, you want to eat a diet high in fiber. Fiber is probably the number one ingredient lacking in the American diet. So when you think of fiber, that is whole, unprocessed plant foods. There's no fiber in processed foods, and there's no fiber in animal foods. So you want to eat a fiber-rich diet. One of the best sources of fiber is ground up flaxseed. That gets a double whammy because you're also getting some precursors to your omega-3s. So ground up flaxseed is an excellent way to add fiber, but think of other ways you can add fiber to your daily diet as well. Another thing you can do is to eat nitrate-rich foods. These are your greens, so kale, spinach, arugula. Also celery, surprisingly, is nitrate-rich. So are beets, radishes, and Chinese cabbage. Some of these I've mentioned are also cruciferous vegetables, which also help to prevent cancer and kind of assist you in detoxification. So when you eat nitrate-rich foods, your body can make nitric oxide, which is a vasodilator, meaning it dilates your blood vessels, makes them more relaxed, and therefore when your heart beats, instead of the pressure going up, your arteries relax, they expand, and they accept that pressure, so it keeps your blood pressure lower. Of course, it goes without saying, you need to decrease your salt. It may not be the salt you're adding at your own kitchen table, it may be processed foods. So unfortunately, many Americans' diets are way too heavy on processed foods, and almost all processed foods have an excess in sodium. So watch the processed foods and watch the salt that you add. And then finally, you want to eat foods that keep your insulin level. Insulin resistance not only puts you at risk for developing prediabetes or diabetes, insulin resistance also is a factor in hypertension. So you want to eat foods that don't make your blood sugar spike, which in turn will cause insulin spikes. So again, these are high fiber foods, lots of raw vegetables, this sort of thing. So hopefully you can make some dietary changes now and keep your heart healthy.
Hi, Dr. Saxena here, Chief Medical Officer at Forum Health. Thanks for visiting our channel. Make sure to subscribe to get the latest insights and information on functional and integrative medicine.